And a good Monday to all, and thanks for joining us as we begin this week and focus on reopening the county and working on key goals and strategies to make sure that is done in a responsible manner. Mayor Demings and Mayor Dyer will talk about that process. We have information on the new testing sites by Dr. Yolanda Martinez, the Health Services Director for Orange County. New information from the state, of course, to be delivered by Dr. Raul Pino, the Director of the Florida Department of Health here in Orange County. Information on enforcement, schools, and the courts from Orange County Sheriff John Mina, Superintendent of Orange County Public Schools Dr. Barbara Jenkins, and Don Myers, Chief Judge of the Ninth Judicial Circuit, respectively. We start with Orange County Mayor Jerry Demings. Mayor.
All right, good afternoon. Thank you all for being here once again. Last week was quite a very active week for us here in Orange County, and we start this week again with a number of activities. I have three goals really for this week moving forward. One is to obviously increase testing and the convenience of testing throughout Orange County. Again, I believe that the data that we receive as a result of the testing is important to those of us in the public sector making decisions. The second goal is to support the reopening of businesses with adequate personal protective equipment, and we look to receive supplies of hand sanitizers and masks this week that we should be able to redistribute to our small businesses. And then the third goal this week is get final recommendations from the Economic Recovery Task Force to support the Phase 1 reopening standards and help businesses and the public prepare for Phase 2. And that Phase 2 will happen at some point in the future. It could be a month away from now or beyond, but we began that planning process now. On Friday, I signed an executive order requiring social distancing and face coverings for places of business. The executive order states that employees and patrons of businesses that require employees and patrons to be within 6 feet of one another, they must wear a mask, a face mask or covering, unless the wearing of the patron's face mask or covering would impede the patron's service, in which case only the service provider must wear a mask or face covering during that interaction. For the rest of our county residents, I strongly encourage you to wear a face mask or covering when out in public. You can find the entire order on our website at ocfl.net/coronavirus. Friday night, I sent a letter to Governor DeSantis asking that he allow barbershops, nail salons, and hair salons to be part of the Phase 1 reopening. I believe this matter is a matter of personal hygiene, and the shops and salons should be allowed to open. Within hours after sending the letter, we received communication from the governor, and we were able to successfully schedule a meeting on Saturday in which we met and had a roundtable discussion with personal service or personal care business owners as well as medical experts. And I appreciate Dr. Pino for participating in that event with us, along with several of our small business owners who represent hair salons, barbershops, and nail salons. The owners, from my perspective, did an admirable job of pleading their case to the governor and why they should be allowed to reopen. I do see the salon owners as part of the overall health of our community, as we all have to be concerned about our personal hygiene. And so I was definitely supportive of them opening. From my perspective, the interaction went well. The governor seemed to suggest that he will allow the businesses to move into the Phase 1. The question was when will that happen? He gave a commitment that he would look early this week and have conversations with his staff in Tallahassee, and then respond back to us. Of course, this was a statewide issue, and I look forward to hearing more from the governor. We remain optimistic that perhaps as soon as this Friday, he would make a decision and we will be able to allow such businesses to reopen. Orange County now has 1,438 cases, up 4 cases from Sunday. 35 people have died as a result of the disease here within this county. We have now tested over 29,000 individuals for COVID-19. Over the last 2 days, individuals have been testing positive at the very low rates of 0.9% and 1.1%. Dr. Pino will get more into that with you. At some point, we've seen a positive rate as high in this county as 5%, 6%, 8%, but below 1%. You know, I think overall that means that yes, those numbers are low. They seem to continue to be low, and as we reopen businesses here, we want to continue monitoring those numbers to ensure that they remain low. Otherwise, we'll have to make some adjustments going forward. So I appeal to our residents here in Orange County that it is important that they continue to embrace the social distancing that we put in place. It is for all of our best interests to be able to do so as we go forward. This week, 2 sites operated by the Orange County Health Services will be open today through Friday. They are in 2 of the zip codes for the highest numbers of the coronavirus cases that we have in Orange County, of course, 32822 and 32824. You will hear shortly from Dr. Yolanda Martinez, the director of our Orange County Health Services. You can also go to our website at ocfl.net/coronavirus for other locations that we will be doing testing here within Orange County. And many of you know that at the beginning of April, we launched a hashtag Full 7 Day in support of our local restaurants. It was an overwhelming success. And today, I'm happy to announce a new campaign in partnership, again, with Visit Orlando, in which we will launch a campaign, hashtag Full 7 Dates. For the next several weekends, Visit Orlando will promote virtual date night activities that you and your significant other can watch together online or participate in together online. In addition, there will be other date night activities you can do in our community and still stay socially distant, but not from each other. On those nights, we encourage you to support our local restaurants and order a romantic meal, but eat it at home. You know, even though some restaurants will be open, but we want you to enjoy your significant other. And during this time, it is important that we take a moment just to relax and be ourselves and try to return to some sense of normalcy. My wife and I order takeout these days on Thursdays, and I always look forward to spending a special evening with her when she's in town and not in Washington, D.C., just the 2 of us. Our kids, fortunately, are all adults, and so we like for them to eat somewhere else. But we are seafood lovers, and we like to enjoy seafood at a variety of places, but one of our favorites for takeout these days is Bonefish. They're in the Dr. Phillips area. But for a complete list of participating restaurants, you can go to visitorlando.com/to-go. Visitorlando.com/to-go. And we want you to post some of those photographs of yourselves and your restaurant takeout with the hashtag, again, 407 dates. And so that's the update that I offer at this time. I'm going to turn the microphone over to Mayor Buddy Dyer of the City of Orlando.
Thank you, Mayor Dennings. Certainly, we all know that COVID-19 has impacted every single person in our community, especially our business owners and their employees. So today marked the start of phase 1 of the statewide reopening. And over the last few weeks, the city's been working with local businesses to get them on a path to recovery. We were able to hear from business owners and learn about what they believe they needed to help their businesses reopen and rebound. As a result, today we announced the immediate actions that we are taking to allow businesses within the city limits to to temporarily expand their operational space and market their businesses outside. These opportunities include allowing businesses to expand retail sales and restaurant seating into outside areas like private parking lots, authorizing businesses to use small tents to accommodate sales and seating outside, granting businesses the ability to use extra banners and signage for marketing. Additionally, on Monday, our next City Council meeting, we'll add a couple of additional items that need council support, allowing businesses to safely expand sales and restaurant seating into public rights-of-way. So that would be sidewalks adjacent to their establishment. A program that will cover the cost of downtown parking, both in our garages and on street, to encourage residents to patronize the businesses in the urban core. And all of those will be done without the need of any permitting or application, and we're waiving all fees related to any of that. So we hope those changes will help our businesses open and operate safely. Mayor Demings has reiterated that it is an important part of our community's recovery forward to responsibly continue and increase the COVID-19 testing. So today, through a City of Orlando partnership with Walmart and Quest Diagnostics, we launched a drive-through testing site on Goldenrod Road. The site will be open 6 days a week, Monday through Saturday from 7 a.m. to 1 p.m. Residents and healthcare providers and first responders can make an appointment for testing by visiting MyQuest COVID Test. That rhymes. MyQuestCovidTest.com. As a community, we're able to be here today and start the reopening of our businesses because of the collective actions that we have taken over the course of the last 6 weeks. But we have to remember the virus isn't done. Entering this new phase doesn't mean that we can stop being cautious. Instead, we must continue to be responsible by practicing physical distancing, wearing face covering, washing your hands, and keeping good hygiene habits. We can't be complacent, but together we can continue on this responsible path and ensure the steps we're taking to protect health and well-being for all of us. I'm not sure which doctor I'm supposed to call on. Dr. Martinez.
Thanks so much, Mayor. Good afternoon to everybody. So as Mayor Demings mentioned, I'll provide a brief update on the 2 sites that County Health Services has been operating since last week. On the 3 days that we operated, Wednesday, Thursday, and Friday, we saw a total of 978 residents, conducted 978 tests. We're located at the Ventura Elementary School, and we're very grateful to Orange County Public Schools for allowing us to be there, and also at the Youth Sports Complex located in the 32824 zip code. So of the 978 tests that we did last week, we already received results for 525 of those, and 4 were positive. So a very low positivity rate, as the mayors have been saying, and as Dr. Pino has mentioned in the past. I think it is important, as both mayors have mentioned, that although we are doing well as a community, we have a very low positivity rate. We should not let our guard down. What this means is that our leadership has done very well in guiding our community. They took very early decisions that were very vital to our community, and our community has listened. Our residents have also listened and have followed the guidance. So this is the time that we must continue to wear our masks when we are in public, observe social distancing, and good hygiene, washing our hands. Because we have to remember, and I know Mayor Demings has said this before, this virus is very deadly, and it's looking for the right circumstances to strike and cause damage. So we need to be very cautious and continue what we have been doing so far, which has worked relatively well for our community. Of course, we keep in our minds and in our thoughts those individuals that we have lost as a result of the virus. We are very pleased at the response of the community to the 2 testing sites that we have opened. If you want to book an appointment at the Ventura Elementary location, you need to go to the ocfl.net/Ventura Elementary site, or if you want to book an appointment at the South Orange Youth Complex, visit the ocfl.net/South Orange. The 2 sites are currently open Monday through Friday from 9 a.m. to 4 p.m. Registrations continue to be well, though they're a little low at the south location, but we're still wanting you to go over there. We're testing individuals 18 years of age and older. The testing is free, and the person does not have to show to have symptoms. So in that case, we're not necessarily following the CDC guideline for some of the testing sites that require the person to have symptoms to be tested. So once again, let's continue doing what we have been doing so far. We're doing remarkably well as a community, and you keep your hygiene standards up, wearing your mask and social distancing. And with that, I'd like to pass it over to Dr. Pino.
Can you put it up? Good afternoon. It's a pleasure to be here. Thank you, the press, for being here with us. Orange County has 1,438 positive cases with a 4.9 positivity rate. I was waiting for this, so let me say this first. This is a letter that we received at the health department from Mrs. Strug, a resident of Orlando, who said, and this person went to the trouble of finding paper, writing. It's quite beautiful. We sent it around to all our staff, and people were really, really touched by her note. Her note says, Dear health care helpers, thank you for keeping everyone healthy and safe. I hope every single one of you that works there are not getting the virus that is going around. I am so thankful for the helpers that work there. I appreciate you being there every single day. Love, Avery. So this is a resident of Orlando, Miss Avery. Thank you very much for your note. It really touched the hearts of many of our workers at the health department, and we made this thank you note extensive to all healthcare workers in Orange County. 29,000 residents have been tested, as the mayor said, and I want to highlight the point that when we talked to you last Friday, our positivity rate was 5.4. Today is 4.9, continue to decrease. And the last 2 days, one day was below 1%, and yesterday was a little bit above 1%. As I said this morning in our meetings with the task force, the county is in good shape to start phase 1. How fast are we going to start phase 2, or how fast are we going to meet the prerequisites for phase 2 as set out for by the White House, depends on how well we implement phase 1 and how careful are we with our washing our hands, covering our mouth and our nose, and keeping social distance when it's possible. And those elements are critical for us to continue to move this way. If we do not take the precautions that we need during increasing social interaction, we could go back to where we were. And we don't want that. No one wants that. A new fatality was added to our list. Our condolences to her family, an 83-year-old female, white, non-Hispanic. We don't know the exposure. We don't know any pre-existing conditions. And the person was asymptomatic. On that, we have a new data to offer you. 10% of all cases reported to Orange County so far has been on asymptomatic people. 10% of all positive tests in Orange County so far are of those of asymptomatic people, which give us an idea of how critical asymptomatic people are in the transmission of this disease. That's why it's so important that those precautions that are being put in place by the federal government, the CDC, and by the mayor's executive order, recent executive order, are so critical to follow. We don't know who may have it. So it's important to protect everyone and protect from everyone. And that's critical as we enter the new phase. During the last 2 weeks of our mobile testing, we tested 2,689 individuals with 19 newly diagnosed positive cases, for a percentage of 1% in total, including newly and known, and for newly diagnosed, the percentage is 0.7. On the last week, on Wednesday that we were here, Wednesday we tested at Camping World, 391 individuals, 6 positive for 1.5%. And on Friday, May 1st, we tested 428 individuals at Blanchard Park, and we have not positive cases from that testing. Again, I want to encourage and congratulate also our community for taking all the steps needed to control this pandemic. I think we are in good shape to start our phase 1. And again, how good our shape is going to be for phase 2 will depend on what we all do together to fight this pandemic. With this, I would like to introduce Sheriff Mina.
Thank you, Dr. Pino, and good afternoon. So there seems to be some confusion on how some of the restrictions in both local, state executive orders will be enforced as restaurants and other businesses have begun to open. So I just want to clear a little bit of that up. So believe me, law enforcement in this community knows how important it is for our businesses to be up and running, and for Central Florida economy to get back on track. But we just want to let you know the Orange County Sheriff's Office, the other local municipal police departments aren't going to be proactively going into these businesses and these residents in the restaurants or other places of business to monitor whether they're following the orders. But if anyone believes that any of the licensed business operating contrary to the governor or the mayor's executive orders, you can call local law enforcement. Those businesses can also be reported to the Department of Business and Professional Regulation complaint filing portal at myfloridalicense.com/DBPR. I want to be clear, our residents can always call law enforcement. We will respond to calls when people have concerns, as we have been while the stay-at-home order has been in place. In most cases, our deputies, our law enforcement officers have been able to speak with the people to get them into compliance if they were out of compliance. And I also want to say it's up to everyone as individuals and business owners to be responsible for our safety and well-being as it relates to the reopening of businesses. What we are most concerned about are the gatherings of large groups. So if you go somewhere, someplace where proper social distancing protocols are not being followed, especially if they are egregious violations, by all means, report that to law enforcement. But more importantly, don't patronize those establishments if you don't feel safe because of that. But we want to know about that so we can stop it before it starts. So, over the next weeks and months as we get used to this new normal, I want you to be assured that the men and women in law enforcement remain committed to keeping our community safe. And remember, even though crime is down in Orange County during this pandemic, there are still criminals out there breaking law and are out there wanting to victimize people in our community. So that's what we want to focus on. We'd rather not focus on violations of the order, but we will, because it will keep our community safe. And in a moment, I'm going to introduce Dr. Jenkins, but did want to let her know that we are still patrolling all of the schools. We are continuing to have our school resource deputies keep an eye on those schools just in case there are any unwanted visitors. So with that, I'll turn it over to Superintendent Jenkins.
Thank you, Sheriff Mina, and thanks to our mayor and all of our community leaders who have tirelessly worked to make sure our community is safe. Four things I'd like to mention concerning Orange County Public Schools on behalf of our school board and my administration. We take all of these issues seriously as well, and I greatly appreciate the partnership of our school board as we lead the district through this crisis. It is a good time to remember that May 4th is Teacher Appreciation Week. And normally we would have lots of things going on at the school, parents bringing in items, children bringing in gifts, so many of our partners in education providing bonuses for our teachers by way of gift cards and various donations. Well, school's not in, but teachers are still teaching. And so I want to first thank all of our teachers for their tireless effort in distance learning, and then encourage our entire community to make sure you thank a teacher for the work that they do on behalf of our children. Not a bad idea either to thank those family members at home who are partnering with teachers in order to complete the distance learning. I encourage my young people, got just over 3 weeks left to go. We need them to finish strong, but thanks to all of our teachers on behalf of our board and all of our administration. Secondly, we will be holding virtual graduation ceremonies for all of our 20 high schools the first week in June. My heart goes out to families and to our young people who are so looking forward to that final graduation event. I will tell you, we are holding dates in July. We have some tentative dates we're holding in July. We're trying to wait as late as possible just in case we're able to actually have face-to-face graduation ceremonies. And it is certainly would be our joy and our heart's desire that we're able to have those face-to-face graduation ceremonies. So we're trying to wait before we announce official dates. We will get you some tentative dates in July as soon as possible. The later we wait, we believe we might know better whether or not we're able to have those in-person graduations. I know it's the hope of our young people and of our families. Thirdly, I wanted to announce that about 20% of the OCPS population will be, employees will be returning to work this Wednesday. Honestly, we have over 25,000 employees. A small percentage of those employees will be returning to work that cannot continue to telework or may not have had the ability to telework to start with, but they are going to help us close down this school year. Overdue work orders in excess of 400 need to be done. Buses need to be serviced for our eventual return to servicing. And we have to continue our grab and go program, which is currently being staffed largely by a temp service, helping us keep those meals going to our young people. Grab and Go, by the way, has reached just over 2 million meals being delivered to our young people. So employees will be coming back on Wednesday, those who have been notified. We will still have office hours from 9 to 2, Monday, Wednesday, and Friday of this week. Those employees are returning on Wednesday. Next week, we will return to a Monday through Friday work week. Still, our hours will be from 9 a.m. to 2 p.m. All of our work sites will, of course, practice the social distancing guidelines, CDC and the mayor's guidelines as reported. We expect our employees to be in safe environments. And then lastly, our mental health services team continues to have a helpline available for parents and for students Monday through Friday. Phone number is 407-317-3694. Of course, you can always call the 211 helpline if you're experiencing a crisis or an emergency. Always visit our website, ocps.net, our Facebook or our Twitter sites for the latest updates concerning Orange County Public Schools. Thank you again for all of your support as we wind down this school year, and thanks again to all of our wonderful teachers. Let me turn it over now to Chief Judge Myers.
Thank you, Superintendent, and thank you, Mayor, for inviting me today and for the opportunity to continue to communicate with our community about the important things that are going on at the courthouse. The court continues to be committed to this health and safety of all of the people who work to serve inside of the courthouse, as well as to those people who come to the courthouse for the services that we offer. There's been some confusion about the recent order from Governor DeSantis that effectuates a partial reopening of the state. And I wanted to be clear that the Governor DeSantis's order does not impact the operations at the courts or the courthouses. Those are unique operations. We are governed by the Florida Supreme Court and its orders. And as a result, we will continue to follow those orders and will continue to limit access to the courthouse to only those proceedings that are defined as essential by the Florida Supreme Court and that are critical to the state of emergency or the public health emergency that we currently find ourselves in. Those services, just to remind you, and this is through May the 29th under the current Supreme Court order, the things that we are doing as essential services or critical proceedings are first appearances for folks who've been arrested, criminal arraignments, hearings in motions to set or modify bail, juvenile delinquency hearings, and juvenile dependency shelter hearings. hearings on petitions for injunctions related to the safety of people, hearings on petitions for risk protection orders, Baker Act and Marchman Act hearings, guardianship hearings, and hearings on petitions for extraordinary writs as may be necessary to protect individuals' constitutional rights. In addition, we are handling those proceedings that are essential to the public and health emergency. That includes violation of quarantine or isolation orders, violation of orders to limit travel, violation of orders to close public or private buildings, and the enforcement of the curfew that remains in effect here in Orange County. There are many non-essential services that are continuing. However, they are continuing remotely through video conference and through telephone conference. If you are a court user and you have a hearing that has been scheduled and canceled, you will be contacted. Notice will be given to you, and you'll have an opportunity to be heard through those remote means where possible. Additionally, court users are always free to file pleadings through the court's e-portal, which is available on the internet. Just this afternoon, the Supreme Court entered another administrative order extending the time through which we will not be calling jurors down to the Orange County Courthouse. That extension is through July the 2nd at this point. So there will be no jurors summoned between May the 29th and July the 2nd, as has been the case since the beginning of the pandemic now. We are continuing to do everything that we can to continue to provide access to justice while safeguarding the health and welfare of our community. So I want to express my appreciation to those of you who have engaged in disseminating this message and remind you that the circuit has a dedicated COVID-19 website or page on our website at ninthcircuit.org, where you can obtain copies of all of the orders as well as any other additional information that would be necessary for you in your interactions with the court. Additionally, for the most updated and fastest way to update information, we encourage you to follow us on Twitter or Facebook at Ninth Circuit FL. Thank you, Mayor.
Okay, we'll take a few questions. As you can see, we had quite a number of speakers this afternoon, so we will endeavor to answer your questions as soon as we can.
Hi, Eric Sandoval with News 6. Question for Dr. Pino, and maybe Dr. Martinez as well on this. Dr. Pino, you had mentioned that 10% of the 10% of the cases were asymptomatic in their testing. Can you speak to the people who may be watching this who think, I feel fine, I don't think I have it, why should I go get tested?
So, we think really, as I said before, that asymptomatic people are playing an important role in the transmission of the pandemic. Why is that? Because if you don't feel sick, you normally will not stay home, you will not refrain from activities, and you will be in contact and going out and about. And as we go along testing, especially in assisted living facilities, as we increase the testing over there, we have found that there is a significant number of people who are asymptomatic. And probably even when we test more and when we get into antibody testing, we will realize that that number is quite large. So that's a hypothesis that we have to put in place. Why is important? Because, as I said before, we have to assume that we can get this from everyone. And especially if someone is asymptomatic and is not experiencing fever, it doesn't feel ill, it doesn't look ill either, you will not protect for an individual like that, normally, even within your family. So it is important that we keep that. And another data, probably the most important data that I forgot to highlight, is that 93% of all our cases have recovered in our data set. Why is that jumping? That is jumping because those are the initial cases, and now as a number of new cases decrease percentage-wise, then the number of cases that recover will increase. About 93% of our cases have recovered.
Are
Are you urging everybody to go get tested?
Everyone who wants to be tested should be tested, as everyone should know the results. And what is also important for people to realize when they get tested, and that's the other coin of the asymptomatic people, is that now because you are negative, it doesn't mean that everything is okay. You can acquire it tomorrow. You are negative today. So it's important that even when you are negative, you continue to take those precautions to protect yourself from getting infected.
Buenas tardes, Félix Pirela de Telemundo. Doctor Pino, doctora Yolanda Martínez, tengo dos preguntas. La primera sería, hoy comienza la reapertura de ciertos negocios, por ejemplo, como restaurantes al 25% de su capacidad. ¿Hay algún tipo de plan que ustedes tengan preparado de haber un repunte tomando en cuenta que tenemos aproximadamente 20 días con los casos bajando? Si llegara a haber un repunte con esta apertura de algunos negocios, ¿hay algún tipo de plan B?
That's a very good question. There is not a plan B per se. We will have to see. Oh, la pregunta fue en español. Tendríamos que ver, no hay un plan B, tendríamos que ver qué es lo que está sucediendo, cuál es el tipo de transmisión que está pasando. ¿Está esto limitado a un lugar específico? ¿Cuáles son las condiciones de ese lugar? Y nosotros responderemos adecuadamente. Tenemos un grupo de medidas, las que hemos utilizado anteriormente, y otro grupo que pueden contribuir a contener y que podamos poner una pausa si es necesario. También otra cosa que vamos a tratar de hacer diferente es empezar a hacer pruebas a las personas que vamos entrevistando que han estado con contactos positivos, respondiendo a la necesidad de encontrar más personas asintomáticas. The question in English, the question in Spanish translated to English was if we have a plan B in case that we see a resurgence of the number of cases. The answer was that we don't have a plan per se, but we have all the measures that have worked before that we can instaurate. But it will have to do a lot with the context of the increase of the infection. Where is that happening? Is that located to a place? Is that located to a type of activity? Is that located to a specific group of individuals? And we will act accordingly. And part of that effort also to contain any possible outbreaks is in sync with the role that we think asymptomatic people are playing, is that we are going to start testing through the networks that we are interviewing people, even when they may be asymptomatic. Anyone that has been in contact with a positive person that may come in contact with us through trace investigation, we may decide to test them so that we offer that opportunity to find more asymptomatic people out there.
La segunda pregunta para la doctora Yolanda Martínez. Doctora, ¿cuál es el balance que tuvieron en los primeros 3 días de pruebas en los puntos más calientes, que en su mayoría son comunidades hispanas, como el 32822, que es la Escuela Ventura, y el 32824, doctora?
Perdón, ¿cuál es la pregunta? ¿Cuál es
el balance que tuvieron en cuanto a pruebas? ¿Cuántos casos positivos tuvieron? ¿Cuántas pruebas en total hicieron en los primeros 3 días de la semana pasada en los 2 puntos más calientes del condado?
Claro. 978 personas recibieron pruebas en los 3 días y de esas 978 hemos recibido resultados hoy de 525 personas. De esas 525 personas, 4 fueron positivos. Así que el grado de positividad es bajo, pero queremos que las personas sigan haciéndose la prueba. The question was of the 2 sites, and I had already provided this information, of the 2 sites that we have seen in the last 3 days, in 32822 and 32824, what was the total of patients or residents that we saw, and what was the result of the test. We saw 978 in the 3 days of testing. 525 results have come back, and of those, 4 were positive.
Other questions?
Buenas tardes, Alibet Suárez para Más 100.7 FM. Mi pregunta, tengo 2 preguntas. La primera, ¿cuál es el mensaje para la ciudadanía en general que aún piensa y se preocupa que los números de casos del coronavirus puedan incrementar y si puede haber una recaída? Esta pregunta puede ser para el doctor Pino o para la doctora Martínez.
El mensaje a la comunidad es que tenemos que seguir vigilantes, y lo hemos repetido y lo hemos dicho desde un principio. El hecho de que hemos tenido relativamente suerte en nuestra comunidad ha sido el resultado de decisiones que se tomaron temprano y de que la comunidad ha respondido. Claro que tomamos en cuenta las personas que hemos perdido desafortunadamente como resultado del virus, pero tenemos que seguir vigilantes, tenemos que seguir haciendo las cosas correctamente, tenemos que seguir cuidándonos de no estar muy cerca de otras personas, de si tenemos algunos síntomas, inmediatamente visitar a nuestros doctores, cubrirnos la cara, buena higiene. Así que el mensaje es que sigamos haciendo lo que estamos haciendo, tal vez un poquito más, y seguiremos en el camino correcto. The question was, what message do we have for the community in the effort that we're having, and so that they continue working towards eliminating the virus? And the response was that we need to continue doing what we're doing. We have been repeating over the last few weeks that we have been here and asking the community to observe social distancing, to wear masks, to use good hygiene when washing their hands, and we're asking them to redouble on that. And also the fact that, as I mentioned earlier, the leadership of the community of the county took decisions early on has helped us sort of navigate through this better than we would have otherwise.
Gracias.
Dr. Pino.
Mi siguiente pregunta es, la Junta de Trabajo para la Recuperación Económica está justamente trabajando en campañas para educar al público sobre procesos y procedimientos de salubridad y seguridad. ¿Están considerando ustedes a los medios de comunicación en general para propagar este mensaje y también a los medios hispanos en particular?
La respuesta es claro. ¿Cómo no? Tendría que ser, esa es la única manera. Y no creo que solamente los hispanos, hay otros grupos muy importantes en la comunidad que también en otras lenguas deberían recibir la información, y estoy seguro la van a recibir. Todo lo que viene del Departamento de Salud es también traducido en las lenguas que se hablan más frecuentemente. The question was, are we going to engage with the Latino media and the media in general as we develop campaigns to educate the public on what procedures to take, they should take? And the answer was, of course. And of course, the Latino media is going to be engaged. But not only the Latino media, there are other sizable minorities in our community that speak a diverse range of languages that will, of course, will make an effort to try to meet that demand.
Stephanie Quinu with Spectrum News 13. Mayor Demings, I had several economic-related questions. As we try and start phase one, can you talk about the potential losses that the county might be looking at? And do you have any idea whether commissioners are even looking at cutting services or staff because of this?
At this point, we're still very early. Most of the economic impact on Orange County government to date is well within the means of our current budget. However, moving forward, there's no question that this event will have a multi-billion-dollar impact on our community. And so we will see a decline in our revenues. So the guidance that I have given at this point to all department heads and constitutional officers who derive a portion of their budget from the taxpayer dollars for next year is to look at no new positions with the exception of those with life, health, and safety or wellness types of job responsibilities. And we're looking at 0% pay increases next year, with the exception of those that we are contractually obligated to do. So we're doing those belt-tightening things at this point.
A large part of that revenue does come from conventions. The county has lost hundreds of millions of dollars, obviously, since conventions had to be canceled. Where does that money typically go? How is it distributed? And now, because of that loss, what could be on the chopping block? I mean, what are your feelings on that?
Fortunately, we have very healthy reserves to be able to sustain and maintain the convention center. And so at this point, we were running ahead where we had been up until March. The revenues were ahead, so we're optimistic that as we begin to reopen, that we'll recover some of the revenues from the tourist development tax or the sales tax. But it is unlikely that we're going to fully recover during this fiscal year or the calendar year in question. So we will see the most significant impact on our budget, perhaps not in the fiscal year 2021, but the fiscal year 21-22. So that's because of how the delay in the valuations of properties occur. The valuations were essentially on the books in January of this year. So prior to the pandemic is what you will see our taxpayers tax at, what the value of their properties were as of January. But that does mean that it's going to require all of us to look within our respective budgets to look at being very measured in our approach to expanding those budgets. Now would not be the time to expand our budgets significantly. Okay.
Lauren Seabrook, Channel 9. Mayor, I spent a significant amount of time this weekend speaking with restaurant servers who were going back to work today. Many of them were very nervous about going back. They felt like they weren't prepared. They were on their own to get things like masks and hand sanitizer. And they basically were told if they weren't coming back to work today, they were going to lose their job. They didn't feel like they had a lot of say in the matter, and they wondered why there wasn't any representation on the task force of some of the servers who don't really have a choice in coming back. Have you thought about having that kind of representation, and what are the rights of these servers?
The business owners are responsible for their employees in their respective business units. And so some of them have been servers, some of them have been wait staff and what have you. So it's very difficult for anyone to know the breadth of everybody's experience that was asked to serve. So it had to be a limited number of people. Going forward, it's really up to the individual business owner to make the types of decisions about whether to re-engage, to open or not to open. What we wanted to do was give all of the business community ample time from the point that the decision was made by the public sector to that they could reopen. But the governor made his decision. And so it wasn't a lot of notice from that decision-making point to the point that business is open. There's nothing that says that a business must open today. You know, of course, they were able to open it as of 12:01 a.m. today. If the business was not prepared to open, they simply could have stayed closed down. If those employees didn't return to work, that business wouldn't be able to open. So getting into the employer-employee kinds of relationships, it's kind of disheartening to hear that the employers were not sensitive to the plight of their employees, which is why we have endeavored to, through our Economic Recovery Task Force, to give as much lead notice as we possibly can before you go into those various phases. So I would say to that employee, that's something that they should take up with their individual employer. Okay, other questions?
This is for Dr. Pino.
Dr. Pino?
The information about the person who died, who was asymptomatic, is interesting. I don't know if you know why she died or what the cause was.
I normally don't know. So in the health department, we have a principle. If you don't need to know, just don't know it. Because of the HIPAA. So the least you know about a person is the least likely you are to disclose HIPAA information inadvertently. You could. I don't know. I really don't know.
That leads me to my major question, which is exactly who do you want to be tested? Everyone? Or is there a precise group that you want to? And what are we looking for? And the next part of that is, do we have enough tests to do that?
All those questions are good, all in the right sequence. Who would like to be tested? So now that we're moving another mode of the pandemic response. So now that we have reduced community virus level, for HIV it's called community viral load, and I think for this one they probably will call it the same, and it can be calculated, the amount of virus that is out there. And for so there are groups that we are very interested in. Healthcare workers is super important to test as many as you can. And if you can, all of them. And some of our hospital systems are doing just that right now. It's critical important because also to know if some of them are already being exposed so that you know who can really get close to other patients. That's a group. I will be very interested in the homeless, people who are experiencing homelessness, because they live in a congregated environment, because they normally don't access healthcare services. Although we have healthcare, the healthcare network for the homeless, we are working with them to increase testing at shelters. We also would like to see first responders to be tested as much as we can. And we would like to see all, if possible, people living in assisted living facilities to be tested. And we now voluntarily, for those who want to participate, the Department of Health, in coordination with the National Guard, is conducting testing in some facilities that have agreed voluntarily to test all the residents and all the the workers. And in some facilities that we reported a few weeks ago, they were on their own, they tested everyone, and they found 6 residents who were asymptomatic. And I think that put that facilities in very good shape to control the environment, to isolate, and to also be able to protect those who were healthy at the time. And of those 6, only 1 developed symptoms a couple of days after it was diagnosed. So again, this is to the importance of asymptomatic people. And we should try to test as many people as possible. But it's going to be very relevant for people who are hospitalized, for healthcare workers, for first responders, people experiencing homelessness, and for people living in assisted living facilities.
Okay, we're going to do one more question, and then we're going to conclude the press event this afternoon. One more question.
All right, this one comes in from Ryan Lynch with Orlando Business Journal. Mayor, have you gotten a chance to see businesses reopen? What have you seen or heard so far in terms of compliance to the guidelines?
Okay, I've had the privilege to go into several businesses that recently reopened, and overall I saw significant compliance. You know, they were doing things in a very safe and healthy way, so that's very encouraging as we move forward. All right, thank you all for coming this afternoon. It's been about 1 hour, so I think that is a fairly good length of time for this press event. We look forward to coming to you again on Wednesday. Thank you very much.